Hi, good morning Darren. My name is Rossi Mackin. I'm your invigilator for the OET speaking session on the 8th of May 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Darren Sains.
And what is your candidate number, please?
My candidate number is 246309190.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you find the best part of being a nurse?
The best part of being a nurse is doing the job itself. It's a highly rewarding career, in which I can directly help the people who need help the most, namely those who are in pain or have some difficulty in their lives. Being there for both patients and their families is a great feeling that I can't think can be likened to anything else. The best part of it is that I'm doing something I love, and I get paid for it. I wouldn't exchange it for anything in the world.
How well can you cope with the advances in medicine?
The medical field has come a long way since the times when nurses have to maintain manual journals and jot down notes consistently. I am pretty familiar with the latest devices, systems, and programs associated with the medical sector. I can work on advanced databases, applications, and analytical software for faster, accurate, and efficient sorting of information.
What are some of the most important things to consider in the nursing position?
In simple and direct words, how not everything can be solved with a drug. We need to look more closely at what's happening with each patient and treat them individually. Sometimes, the words and care that we provide will be more effective and satisfying for the patients than the drugs given to them. That makes the nursing position challenging as well. Hence, it is the most important thing to consider in the nursing position.
How would you work with the charge nurse?
I understand the importance of working in alliance with the charge nurse. It is the charge nurse who coordinates, communicates, and plans the entire department. I would try to understand how that professional wanted to coordinate care together. Then learn about the patient's desired care requests. Then try to make the best decision I can with that information. I firmly believe in the importance of decisions made by the charge nurse, and I respect the position.
How do you handle unexpected circumstances, like short staffing, unfamiliar treatments, etc.?
I take a step back, analyze the situation, and determine the most appropriate plan of action. If we are short-staffed and have to take an extra patient, I will modify my plan and focus on my priorities. If I have to give an unfamiliar treatment, I consult any available materials, such as nursing policies and procedures or manuals, and ask for help. Whatever the circumstance, I welcome a challenge, and always make learning my main priority.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning, Rossi. I am your attending nurse, Darren Sains, here. How are you doing?
Good morning, Mr. Sains. I am good. Thank you for asking. How about you?
I am good. Thank you. Well, Rossi, I am here to discuss the discharge plan with you.
Nurse, I think it is too early for me to get discharged. I am very much concerned about my care and support after discharge.
I can understand your situation. However, I would like to know the support you have at home, from your family or friends, on a regular basis, until you regain your independence.
Yes, I have a granddaughter with me and have got a good neighbor. But, when they leave for college and work, I will be alone.
All right, I understand that. And may I know your concern about going home?
Well, nurse, I am really afraid of walking around independently, and especially of falling over in the shower. I am not prepared to be discharged, nurse.
I acknowledge your concerns. However, the physiotherapist will provide education to you and your family regarding mobility in your present condition, so that you will be confident and capable of doing your daily living activities.
Oh, is it?
Yes, Rossi, try not to worry. The decision has been made following your satisfactory progress.
All right, nurse. By the way, when and how will I receive my medications, especially for pain relief?
Your questions are reasonable. After getting the discharge summary from your doctor, the pharmacist will deliver medications before you are discharged.
Okay. Nurse, I am also worried about looking after the wound area on my hip.
Your concerns are quite sensible. Giving you the discharge means we are not leaving you halfway through your progress. Before discharge, you will be given proper instructions to take care of your wound dressing, and also the remedies you can take in order to have a faster recovery.
Good to hear that, nurse.
Nevertheless, you can schedule your appointment to see the GP when you feel it is essential to have a review, so that the GP will check your wound and reinforce the dressing if necessary.
All right, nurse. I understand that.
Is there anything else that I have to address for you?
Thank you for your consideration. In terms of follow-up care, when is it appropriate to make an appointment?
I appreciate your thoughtfulness. I will guide you through some of the instances, so as to get a very good understanding of the situations when to call the hospital.
All right, you may please.
Okay. If there are any major concerns, such as excessive pain, despite taking medication, seek medical attention.
Okay.
If you notice bleeding from the wound site, call the hospital for primary advice, and visit us for treatment.
All right, I got it.
Also, if you have any signs, like an elevated temperature, you should make contact with us.
Okay.
Situations like these are to be taken care of, and make sure you take necessary steps to be on the safer side.
Yes, nurse, I will.
That's great.
Also, how long will it take to heal?
Rossi, normally it will take 2 to 3 weeks' time for complete recovery. Make sure you follow the medications and our instructions properly. Along with proper diet and wound care, you can have a comfortable recovery period and a faster recovery.
All right, nurse. I understand that. I will take care of it.
Rossi, I'll provide you a leaflet containing the information regarding the post-surgery care, so that you can go through it whenever necessary.
That is so kind of you, nurse.
It's my pleasure. Rossi, always feel free to contact us for any queries. We are glad to help you.
Thank you. And definitely, I will, nurse.
Good to hear that, Rossi. I hope I have cleared all your queries. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OHE speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.